Yali Madad. My name is Alia Hirji, and I'm currently serving as a member of the Aga Khan Health Board and IHP lead of the Northeast region. I'm here to speak to you about cervical cancer. January is officially Cervical Cancer Awareness Month. I will provide you with a brief overview, screening, and prevention measures to protect you and your loved ones. What is cervical cancer? Cervical cancer is cancer of the cervix. The cervix is located at the lower part of the uterus or womb. All women are at risk for cervical cancer. It occurs most often in women over the age of 30. The most common cause of cervical cancer is a virus that is passed from one person to another, which is called human papillomavirus, also known as HPV. Both men and women can be carriers of HPV. This year, it is estimated that there will be approximately 13,000 women diagnosed with cervical cancer, and there will be an estimated 4,100 deaths from cervical cancer. It is important for the Jamaat to note that cervical cancer is one of the cancers that can be prevented and treated. Current guidelines from the U.S. Centers for Disease Control and Prevention recommend the two screenings for cervical cancer. The first screening is a pap test, also known as pap smear. The pap smear is done at the doctor's office. This test looks for precancer cell changes that may become cervical cancer. The second test is HPV testing. This screening test looks for human papillomavirus or HPV virus on the cervix. When should one be screened? If you are between the ages of 21 and 65, you should start getting both pap smears and HPV testing. If both of your results are normal, your doctor may tell you that you can wait 5 years until your next screening test. If you are over the age of 65, your doctor may tell you that you do not need to be screened anymore if you have had normal screening test results for several years, or you have had your cervix removed as part of a total hysterectomy for non cancerous conditions like fibroids. How can cervical cancer be prevented? There is more than 15 years of monitoring and research showing reassuring evidence that the HPV vaccination provides safe, effective, and long lasting protection against cancers caused by HPV infections. Routine vaccination is recommended for both boys and girls starting at the age of 11 and 12 years old, and vaccinations can be started earlier at age 9. Adults aged 27 through 45 who are not already vaccinated may decide to get the HPV vaccine after speaking with their doctor about their risk for new HPV infections and the possible benefits of vaccination. It is important for the Jamaat to note that cervical cancer is one of the cancers that can be prevented and treated. If you have any questions, please reach out to the Access line and always remember to consult with your primary care provider for any questions or concerns regarding your personal health. Thank you and Yali Madad.